Thank you for joining us for our 2022 celebration of Black History Month. As the region's only academic health system, we are dedicated to meeting the healthcare needs of the people of our region. And we have so many talented and devoted people on our team. So we thought it would be interesting and enlightening to hear from some of the pioneers from USA Health and the region who have spent their lives working to eliminate health inequities in Mobile and beyond. Each one brings a different perspective and a different story. We hope you enjoy hearing from them.
I grew up in a rural town north of here, Monroe County, Monroeville, Alabama. I had the great fortune of being the child of two educators. And my mother actually had two brothers who were physicians. One of them trained in surgery and the other trained in neurology, settling in San Francisco, California, and Detroit, Michigan, respectively. So as a child, even though I didn't see them much, I knew that the opportunity to be a physician was one that was clearly viable because I had family role models there that I would see from time to time, but always hear about, and my mom in particular would push that as a career option. During that time, I became even more committed to making my way back to the South for my training. I also made the decisions that it was important to be in academic medicine. I recognized that a person that looked like me, bringing diversity to the healthcare team was important in how patients were treated and how actually the way we interacted as teammates. The best evidence of that importance is the spark I would see in someone's eyes, or a look of surprise, or a look of appreciation when I would walk into the room of an African-American patient, even as a medical student, and clearly they were in a position where they did not expect someone like myself to walk in. Things are changing, but ironically, if you look at the percentage of physicians in this country who are African-American, that really hasn't changed for 100 years. That's sad to see. And in fact, so we're talking about 4 to 4.2% of physicians in this country and in medical school are African-American. And majority of that 4.2% now is actually African-American women. So one of the groups that's receiving special attention are African-American men. But the real issue is African-American physicians in general, where we have a percentage in the nation of 12 to 13% African-American and less than so we're 1/3 of that percentage amongst the physician workforce. And that's right now looks like it's going to be true for some time to come without significant effort and focus on righting that ship. The same is true for physicians of the Latinx community and physicians of Native American descent, where all groups are woefully underrepresented amongst the physician workforce. So in order to provide quality care, it is important that you have a workforce that represents the clientele that they serve. And there's actual data out there now in several places to show that there is what we call concordance, meaning that the physician and the patient have similar ethnic background, that those relationships tend to be enhanced. Patients tend to have better outcomes. There's more higher likelihood of building trust. It's been good to watch that become a primary focus of medical schools and training of physicians at undergraduate medical education level and at graduate medical education level. And I think the goal, though, ultimately is that I think if we can have our physician workforce reflect the nation as a whole, that in the end of the day, we can stop having these conversations. That's probably a few generations away, but I think that's a laudable goal for us for which we should aim.